Welcome. A 36-year-old woman comes to the emergency department with a chief complaint and symptoms consonant with panic disorder, feeling as if she is going crazy or going to die, chest pain, shortness of breath, palpitations, sweating, trembling, and dizziness. She has been to the emergency department several times with the same symptoms, and no physical problems were found. The episodes have occurred once or twice a day for several months, and nothing in particular seems to precipitate them. The patient spends a lot of time between attacks worrying about when she is going to have another attack. The episodes last approximately 15 minutes. The patient denies alcohol or drug abuse, and her only medical problem is hypothyroidism. What is the differential diagnosis? What is the next diagnostic step? Top 2 diagnoses in the differential: panic disorder versus medication. Synthroid-induced anxiety disorder. Next diagnostic step: obtain a thyroid profile and look for elevated levels of thyroid hormone, which if present could explain her symptoms. Objectives: 1. Correctly diagnose panic disorder in a patient. 2. Be aware that medical illnesses, or some substances, can cause panic attacks. 3. Understand how to rule out a medical illness or substance use issue by requesting the appropriate laboratory studies. Considerations: this woman presents with classic symptoms of a panic attack. The attacks first appeared out of the blue and have occurred once or twice a day, every day, for the past several months. They are short-lived in duration, lasting about 15 minutes per episode. The patient spends a lot of time in between the attacks worrying about having another attack, a classic feature of the disease. The patient does not seem to have any symptoms of any other psychiatric disorder. Definition of panic attack. Panic attack consists of discrete episodes of at least 4 of the following: palpitations, sweating, trembling, shortness of breath, feeling of choking, chest pain, nausea, dizziness, derealization or depersonalization, fear of losing control or going crazy, fear of dying, numbness or tingling, chills or hot flashes. Differential diagnosis. Medical conditions causing panic attacks: cardiac, angina, arrhythmias, congestive heart failure, infarction, mitral valve prolapse, endocrinologic, Cushing disease, Addison disease, hyperthyroidism, hypoglycemia, hypoparathyroidism, premenstrual dysphoric disorder, neurologic, seizure disorder, vertigo, Huntington disease, migraine, multiple sclerosis, transient ischemic attacks, Wilson disease, pulmonary diseases, asthma, obstructive pulmonary disease, hyperventilation, pulmonary embolus, neoplastic, carcinoid, insulinoma, pheochromocytoma. Distinguishing panic disorder from other anxiety disorders can often be confusing. Panic attacks can be seen in many other anxiety states, as well as in depression. In fact, major depressive disorder has a high rate of comorbidity with panic disorder. The hallmark of panic disorder is unexpected panic attacks not provoked by any particular stimulus. This condition is distinct from other anxiety disorders, where panic attacks are the result of exposure to a certain cue. For example, a car backfiring might provoke a panic attack in a patient with post-traumatic stress disorder, or being near a dog might provoke a panic attack in someone with a specific phobia to dogs. The other important aspect to remember is that in panic disorder, the fear is actually of having an attack, not of a specific situation. Contamination in the case of obsessive-compulsive disorder or performance in the case of social phobia, or of a number of activities, as in generalized anxiety disorder. Treatment. Best results are obtained when medication is used in combination with a course of cognitive behavioral therapy, CBT. Medical symbol. Thank you for watching. Medical symbol Brain Neuropsych Insights Brain by Dr. Chirag, AIIMS Delhi. Right finger, subscribe for medical insights. Left finger clapperboard. Tap here to watch the next high yield case.